My name's Eleanor, I'm a specialist orthoptist and I work at Moorfields Eye Hospital. So I'm beginning to specialise in paediatric uveitis. Uveitis is inflammation within the eye. A lot of time if it's left untreated it can lead to blindness. A lot of time you find that the inflammation in the joints actually affect the inflammation in the eye, so we work closely with rheumatologists, so it's quite an exciting team to be a part of. So when a patient first presents to the paediatric uveitis clinic, they'll be seen by the nurse for a vision check, a pressure check, and then they'll be dilated. They're then seen by the imaging team for pictures at the back of the eye to look at the different layers. And then afterwards they'll be seen by myself or one of the doctors to examine the imaging, the blood tests, the tests done by the nurse, and then to examine the patient themselves in front of a slit lamp, so illuminating different parts of the eye to make sure there's no inflammation, and then formulating a management plan and presenting that to the consultant. So I did a paediatric ophthalmology course which entailed different types of conditions relating to the eye, but I was mostly drawn to uveitis because there's so many different parts that can be affected and so many different management options, so it makes it really interesting and challenging. Additionally, I love working in paediatrics because the patients themselves are always fun and ask you strange questions. So unfortunately, orthoptics wasn't well advertised when I was applying to universities, so I applied to medicine for ophthalmology because I've always been drawn to the eyes, and then optometry because that's the only other option that I thought existed to be able to work with patients on eye conditions. So that's why I'm really passionate about and making sure that people know that orthoptics is a great career to join. So I did my undergraduate in orthoptics in Glasgow Caledonian University. After studying for 4 years I qualified and then moved down here to Moorfields Eye Hospital. I then did a PG cert in paediatric ophthalmology with the University of Sheffield, and that allowed me to start doing paediatric uveitis. So after qualifying and getting my degree in orthoptics, I applied online to Moorfields Eye Hospital for a Band 5 position. I was successful because I'd had some experience beforehand in retail, so I was able to deal with members of the public, and so once successful in my application I then got an interview. I was then successful in that interview and started here as a Band 5. I then started as a Band 6 after applying for a promotion, and that's when I was allowed to apply for the role of paediatric uveitis. So I think some of the key attributes and skills needed to work in the NHS is certainly compassion. On a daily basis you're working with patients where they have altered visual status and it can be quite distressing to them. So for example, you might have an adult with new onset double vision that's preventing them from driving, or you might have a parent with a child where their vision's reduced but in the other sibling it's not reduced, and it can be quite distressing for the family. In addition, communication is so important because not only do you have to be an active listener to what the patient's saying, but you have to be able to communicate effectively your management plan to the patient and to the patient's parent, and also to the wider team that you're a part of, and especially if you're wanting any additional tests. The best advice that I could give for people wanting to study orthoptics is to come and shadow orthoptists for the day, because the best way to find out what a career in orthoptics is like is to actually shadow someone doing that job.